Good morning.
Morning.
Good morning.
Thank you so much for being here with us on this ongoing series of the trend and outlook of healthcare industry. We're really delighted to have you with us. Uh, Whatever limited I've been able to understand from your phenomenal career so far, you started your journey in life sciences, healthcare, more than 25 years. So we'd love to hear from you. Currently, sort of ran the business at AXIS Kidney Care for the last 4 years. But yeah, so please tell us how you started, where you started, and what made you sort of getting the AXIS Kidney Care, who is ultimately pushing. So in roles you, we have some questions for you to get your perspective.
Sure. So first and foremost, many thanks to both of you and to Protivity for having me here. It's a real pleasure to be here with you guys. Now, my journey started about 30 years back when I started as a medical representative in the pharmaceutical industry. Then came up the ranks, rode the corporate ladder. During the process, worked with organizations like Novartis, Sun Pharma, Zydus, Torrent. And then after 19 years of spending in the pharmaceutical industry, when I was heading the cardiodiabetic business of Zydus, I decided to switch the industry, not in...
Yes.
Yeah, so from pharmaceutical to medical diagnostics within healthcare. So I joined SRL Diagnostics. I worked with SRL for nearly 5 years. I was heading their all India business for pathology, and then 2 smaller stints with 2 more diagnostic companies. This was during the COVID period. And in one of them, I was heading both radiology and pathology. And ultimately, in September 2021, I joined Apex Kidney Care. Initially, I joined as the Chief Operating Officer. Subsequently, I was promoted as the Chief Executive Officer. And then the board was kind enough to induct me into the board. So today I am very happy and very passionate that I lead Apex Kidney Care as a director and CEO.
Congratulations on your multiple hats at Apex. So tell us a bit more about what made you move from pharma to diagnostics and then now to specialty of super specialty healthcare, and especially over the last 4 years, what's your journey been like?
So the move from pharma to medical diagnostics, that was primarily because, the pharma industry, I felt, was getting a lot saturated in terms of the growth potential. Medical diagnostics at that point of time still had enough growth potential, while the business models and the type of work were very, very similar. So that was the reason for the switch. And SRL has always been a large national player. So I learned a lot, but in that stint, what is more important is in pharma, I was only running the business, but in SRL, I was running a part of the whole company as the profile is sort of a regional CEO. So that gave me a lot of exposure in running into other multiple departments, heading functions like finance, IT, legal, operations, HR, all those. Now the shift from diagnostics to Apex.
Well,
So that is primarily the decision was basically 2. One was I wanted to go back to Bombay. In my last stint in Medall, I was in Chennai. The family was in Bombay. But more importantly, when I had met the founders of Apex Kidney Care and when I read about the space, I felt again there's huge growth potential both for the industry, for the organization, as well as for individuals. And why do I say so? Because if you look today in our country, the prevalence of the disease, which is chronic kidney disease, people will need dialysis or renal transplant. Transplants are extremely limited because of multiple factors. I mean, I'm not going in details, but some of them are definitely very clear. Lack of organs, lack of a proper registry, lack of knowledge among the people and awareness about organ donation and all. So dialysis remains the mainstay for life for these people who are suffering from chronic kidney disease stage 5. There are about 2 million patients in this country. Only a small fraction, about 30-40% takes maintenance hemodialysis. And there are multiple reasons for that. So basically, if you look at the prevalence, there's a huge demand and supply gap. So there's a growth potential.
And this under-penetration is largely in tier 2, tier 3 cities, or is it in metro?
Predominantly in tier 2, tier 3, but metro cities also there is a gap.
Oh.
Now coming again to the incidence. So one is you have a set patients who need dialysis to stay alive. The incidence is also very high because the two major reasons are diabetes and hypertension. And India is exploding on both. So there are a large part of population who have been diagnosed with hypertension and diabetes about 20-25 years back, but uncontrolled. So many of them are progressing to CKD5, and hence there's a large incidence. So the prevalence and the incidence gives enough growth potential. So that was the other reason I decided to join the industry, because I felt the space will do well, the organization will do well, and obviously when organizations do well, individuals will automatically do well.
Yeah. So interesting. You talked about the unmet needs, and you said it's more than tier 2, tier 3 cities. Is that an awareness issue, or is that an issue beyond that?
So Vishal, the three major issues are, it's very, very clear. It's affordability, it's quality,
Accessibility.
and accessibility. Very clear, right? So when you go to tier 2, tier 3 cities, courtesy various government schemes and PPP programs under the Pradhan Mantri National Dialysis Program, affordability is met to a large extent because these schemes are free for the population. However, there's a catch there also. I'll come to that.
Yeah.
But in terms of accessibility, there was a huge gap. But now again, I must say that the government of India under the PM&TP program has done splendid work. Today, almost 850 districts across the country will have at least one dialysis center. Now, the point obviously is there's need for more. But the point also here is we have moved a large distance, but we have miles to go. So accessibility is getting sorted out. Affordability is getting sorted out for a section of the people because most of these programs are for the BPL part of the population.
Good.
Quality still remains an issue, but it's very happy and encouraging to see that the government is now focusing on the quality part. They have started focusing. And we as an organization, we as an association, because we also have an association called Dialysis Service Providers Association, we have been continuously lobbying with the government in terms of policy advocacy to monitor quality, to bring in accountability for the service providers. Now, since we are talking about the gap at the affordability part is, see, for a guy who is in the BPL bracket, that's not an issue. Dialysis is provided free to him by the government under various schemes. For a guy who is earning 4 lakh, 5 lakh a month and above, that is also not an issue because the cost of dialysis plus the associated medicines and the complications, that will amount to be somewhere around 50,000-60,000 per month. So he can afford. The issue is the guy who is earning 2.5-3 lakh rupees because he has a EMI to pay. He has to look after kids' educations, aging parents, all these things. And on top of that, when he has to pay 50,000-60,000 from the pocket because most of these are not covered by insurance, he has a challenge. The irony is the BPL schemes are being funded from his money because it is the taxpayers' money. So there is a gap which the government needs to look at. That's one. I'll also would like to mention here, because while the government is doing great work, and obviously it's the government and the private sectors, private companies like us, we have joined hands for the PPP. The issue here is we are currently tackling the immediate need, that is providing dialysis to the patients who need it. But dialysis is not the ultimate treatment. The ultimate treatment is transplant. Now, there are very limited things happening at the transplant. We still have to work very hard as a country on the registry. We still have to work on the organ donation awareness. It has started. And we need to look at programs like swap transplant and all in a very aggressive manner so that this can help more transplant, which will be permanent cure. So that's one. But the bigger piece is, which I always talk to most of the governments whenever I have the opportunity to interact with the policymakers, government is hardly doing anything for disease prevention, because ultimately that's the goal. Otherwise, this...
When you say prevention, what would government do?
So, Vishal, I'll tell you what can government do. CKD progresses in phases. Uncontrolled diabetes and hypertension is the first thing. So that needs to be controlled. Government already has hypertension clinic, diabetes clinic. So they need to monitor the patient's compliance.
What's early intervention?
Yes, that's one. Even if the patient has progressed to first stage or second stage, aggressive treatment and early intervention will delay the progression to CKD5, will delay the dialysis procedure or transplant procedure. So that is what they need to do. And that is a real big area which our government needs to see. They have done a splendid work in tuberculosis in terms of maternal health by public awareness. They need to do similar things for chronic kidney disease. They will be able to prevent a lot many new patients coming into the ecosystem, which ultimately will be a burden to the government.
Yeah.
And the overall public health.
Polio eradication was one such great success.
Absolutely. So, GL, there are multiple such examples in our country which shows that if there is an intent and if the government and the private sector joins hand, nothing is impossible. So, it's very much possible here also.
Wow.
Very interesting. And so, since you spoke about increasing accessibility, increasing awareness, and you've done a phenomenally job till now, going to what, 160 sectors?
So, we have got about 230 centers.
230 sectors. So, from an expansion perspective, what is your vision or what is your outlook for the next 3 to 5 years, and how do you sort of look at it from a strategy point?
Yeah. So, we run multiple business models.
Yeah.
From the expansion point of view, our focus is very, very clear. And the philosophy of the organization is also very clear, which I drive. That is, while we partner with the government and we scale up the centers and we are in multiple number of tier 2, tier 3 and rural areas, there needs to be a balance between government and non-government business so that we are able to take care of the cash flows of the organization. It's very, very important. That's fundamental, right?
This is what, 40% is today?
Nearly 50% plus is government business for us as an organization. Because in the dialysis space, if you really want to get scale, it is practically impossible without being in the government space, because the PM&TP program is really big across the country and the affordability is a huge issue for anyone at the end of the day. So the balance is very important. So keeping that in mind, our focus is very, very clear. We want to consolidate at the government PPPs. And when we say consolidate, I'll explain a concept of dialysis adequacy. By and large, if you go by the global recommendations or even the Indian recommendations, dialysis is to be taken 3 times a week. Now, obviously, there are certain clinical conditions in which the clinician recommends less, and we go by the clinician's recommendation, but by and large, it's 3 times a week. So there are a large number of patients in the government sector who are either on once or twice a week per week on dialysis. So which means they are inadequately dialyzed, their clinical outcomes are less, and survival is compromised. So we are working very aggressively on that with the governments, educating the patients and addressing issues like accessibility and all, wherein we are trying to ramp up this. And this is one of the major growth areas for consolidating the business. On expansion, we are very, very clear that we are expanding through private centers as well as home hemodialysis. But that private center, the geographies are pre-selected based on the demand-supply gap. We have done a lot of homework. We worked with EY to create a white paper, which we presented to the government of India through Nat Health. This was through Nat Health. And following that, we are expanding our standalone centers. So private centers. Basically, this is the expansion plan, but we are also looking very aggressively on inorganic expansion through merger acquisition as well as international expansion, following the basic metrics of M&A as well as the case-to-case business case as it comes, following the financial metrics. So based on that, we are progressing. But yes, this is by and large the the major philosophy.
From a regional presence perspective, you're largely today in South.
So in South, we are primarily in the state of Telangana. We run about 45 centers in Telangana. But other than that, we are concentrated primarily in West and Central. So Madhya Pradesh, Maharashtra, Goa, Delhi city as well. So we have now expanded to UP. We have expanded to Uttarakhand. We are also present in Rajasthan, Gujarat. We have large numbers of centers in Goa, as well as Delhi NCR. So we have about 230 centers across 140 cities in the country today.
Indranil, as you rightly said, you have been expanding throughout the length and breadth of the country, and tech has a great play in terms of how it increases the efficiency of your operations. So as you expand, how some of the tech initiatives or some of the tech play has impacted your service offerings?
So Jill, I'm very happy that this topic comes up. Our founders are clinicians, they are nephrologists. So long back when they founded the organization, they understood the need of the technology drive as well as data. So we collaborated and we created something called as AXIS EMR. This is the first and the most comprehensive renal data management system for dialysis patients in the country. And it is through this AXIS EMR that we enter the dialysis session data of every dialysis session we do. And then we have a very robust quality assurance team at the back end, led by a nephrologist and an entire hierarchy who analyzes the data and takes action. So all this is driven by technology and AXIS EMR. Now, it helps me and the management team and the QA team to sit at head office and monitor the data of each and every dialysis session. Now, we are bringing in a lot of AI layers into it to move into predictive models, which will give us an idea and further improve the quality. Now, this is one piece. Now, based on this, we have already presented our first survival data of dialysis patients in India. We have presented in World Congress of Nephrology in Delhi last year. We have also presented in the Indian Society of Nephrology. This talks about 35,000 patients over the last 15 years. And this is only possible because of technology and AXIS EMR. Now, other than that, there are a bunch of areas on which we are working on. Digital twins is one what we have in our mind. We are moving very aggressively on that, as well as use of IoT devices to monitor various factors so that we can monitor them centrally and human intervention becomes much lesser. So technology is the main thing. It's going to drive not only the quality of dialysis, it is also going to drive other processes in the healthcare industry, and dialysis industry is no different.
When you meant the data which is monitored, I'm assuming that will be the frequency of dialysis, but also would that data include vital parameters of the patients as well?
Absolutely. So primarily, if you have to give a good quality outcome, I spoke about that we have done the survival data. Our survival data is as good as anything in the world. I am not divulging too much into this. This is coming up for publication anytime now. I don't want to steal the thunder. But there are 3 or 4 major clinical parameters in dialysis which are critical for the survival to improve. And AXIS EMR captures each and every one of them, including the pathology reports, the blood work, the vaccination status, the vital parameters of the patient, intradialytic, blood pressure drop, and fluctuations. Every damn thing is being captured in AXIS EMR. The other thing in terms of technology, in one of the states that we run about 70 centers with the government in the PPP program, unfortunately, the number of nephrologists in the government sector in that state is very less. Because, nephrologists as such in the country is very, very less. We have only about 3,000 odd nephrologists for a population of 140 crore.
See?
Yeah, that's it. 3,000 qualified nephrologists for a population of 140 crore. Only that's.
Sorry to interrupt there, but does that also mean that more technology intervention is required?
Absolutely. And that's where I'm coming to. So in that particular state, since the number of nephrologists in the government sector is very, very less, and this 3,000 nephrologist distribution is extremely skewed. You can jolly well understand 90% of them are in metro cities, not even in tier 1. Okay. So what we do is, with the government, we do tele-nephrology there. We have a nephrologist sitting in Mumbai. They do teleconsultation with the patients because we have the entire data online, including the blood work. So the teleconsultation is done periodically, the prescription is generated, and the prescription is handed over to the patients. So this has worked splendidly for us in that particular state. And we have seen significant improvement in survival of the patients. So another test case I would like to, since you raised the issue of technology. So distance traveled is very, very critical to the dialysis center from the patient's residence. So courtesy AXIS EMR, we geotagged the patient's residences and the dialysis center when we took over the project, because we were seeing that patient number is very large, but they are coming much lesser for dialysis, and the outcomes were very, very compromised. So we looked at them and we found out they were inadequately dialyzed. We went further, deep. I personally visited number of centers and we found out that they were afraid of traveling because they had to travel nearly 55 kilometers on an average to avail dialysis. Now, when we geotagged, we measured the distance and we got this mean distance of 55 kilometers being traveled by them. So then we used our helpline at the back end, because there were dialysis centers nearby, but they were not aware. These centers are being run by the government. It is free, quality is same, but because they were not aware, they were going to a larger distance. And then we reached out to them, we explained this to them, and then the mean distance traveled came down to 30 kilometers. It's still very high, but there was significant reduction. What it resulted into, they started coming more frequently for dialysis. The quality outcome parameters improved, and ultimately the survival is improving. So that's another use, a test case use of technology.
Excellent. And while technology is clearly one of the differentiating factors in your case, if you could layer in just 2 to 3 key other differentiating factors which differentiates your company vis-a-vis some of the other competitors or peers.
So the primary factor is we are the only company which is founded and promoted by nephrologists, clinicians. So being that, and then having investors like Tata Capital on the board and Blue Earth, the other investor, I'm extremely happy that as a CEO, I have to deal with a board of directors who are extremely quality conscious, because it makes my work much easier. So the major differentiator for Apex today is the quality. We focus extremely on quality. Our entire focus is to increase the survival of the patient. Because you see, the government is spending so much of taxpayers' money. What is the net impact? And absolutely. So that's a major differentiator. Quality, we focus on quality. We also are technology driven. But when we talk about quality, there comes the next differentiator. Quality cannot be provided until you have a very, very skilled workforce. Now, that's another gap area for industry in this country, to have a skilled workforce for dialysis. So we as a company run something called as Epic School of Dialysis Technology. This we run in collaboration with Tata Institute of Social Sciences. And now Maharashtra State Board of Vocational Education has recognized our course and given us permission to run both degree and diploma course.
That will increase the number of nephrologists that come out.
Not nephrologists, these are nurses and dialysis technicians.
Who operate the machines.
To operate the machines and to provide dialysis, right? So far we have trained nearly 2,000 dialysis technicians and nurses, and many of them, while they get employed with us, and that ensures the quality, many of them are also employed with competition. Many of them are also employed in large corporate hospitals, because it is one of the few courses which is accredited and recognized by government authorities. So that's the differentiator. We create our own workforce, and that's how we create the quality. And we have a very, very robust quality assurance team and the use of technology. Our philosophy always has been to provide global quality care at an affordable price in a sustainable model. So we work a lot on operational efficiencies as well.
Yeah, so you spoke about operational efficiency, and maybe if we go one step further of saying 40% of your patients are through government schemes, right? Then working capital obviously becomes critical. So scaling up, making sure the working capital is taken care of, and at the same time taking care of all the other challenges around upskilling people in. So all of this, how do you manage your operational efficiency? You can share your perspective.
So, Vishal, as a management team, we are very clear in our concept and in our philosophy that we only pitch and jump into a government scheme if we have the desirable IRR for the project.
Yeah.
Right? So we analyze the business case in depth because we are cognizant of the ROC that we need to provide for the shareholders. So we look at the IRR for the project and we decide on a hard stop price. We don't go below that. We are not looking to buy revenue. We are looking to buy revenue which is quality revenue at a sustainable model, giving us the desired margins. So that's one, because we don't bid, we have not bid for many of the projects in the country because we felt that's not sustainable, right? That's one. So margins are by and large protected in the government business. Volumes are never an issue in the government business. You have large volumes. Yeah, that's the important part. So when we consider the business case, we look at the history, the legacy of the government, what has been their payment patterns, and we build a buffer and we create a business case on that. As long as it is within that limit, we have taken that buffer, we are comfortable. But yes, to be very candid with you, there are certain cases where it goes beyond our limit and that impacts the cash flow. Very unusually high account receivables definitely will impact the cash flow and has an impact on the working capital.
Yeah.
So when that happens, we are very, very clear, come what may, we will never compromise on quality. So we then decide on how to manage that cash flow, how to manage the funds, and we go accordingly. But yes, while we are protecting the margins in government business, that's never an issue for us. Sometimes in certain projects, cash flow is an issue, but let me again be very honest here. Over the last 1 year, we have seen some of the state governments really improving on that parameter, and some of the state governments which are working on automation, because with 2 governments, we have entirely automated our AXIS EMR, which means we push in live data from our side to the government, whether it is quality data, whether it is financial data. And that has helped us reducing the DSO days in the finance term and ensuring a better cash flow. And we are now clearly focused on working with the balanced governments on this so that we are able to increase.
It's a good journey. I'm sure government will also recognize and sort of work on it.
Government, in fact, is very happy, Vishal. I mean, they are very keen, they are very happy because it also cuts down multiple layers of approvals that otherwise goes into the system. And they also have complete transparency. See, I mean, at the end of the day, when you as a transparent organization are dealing with the government understands that. And so far, my experience has been the government appreciates that.
And while you touched upon your increasing presence in tier 2 and tier 3 cities, which are at this point in time quite underpenetrated, as you started getting into those zones, what were the key challenges? And again, were you able to, not in all the cities, you can set up a big center and so on. So how has concepts like remote dialysis or mobile dialysis helped you in this journey?
So first of all, I'll take the question in 2 parts. You spoke about what are our key challenges.
Sure.
So when we go into very remote places, very smaller cities, rural areas, the biggest challenge that we face is to get the skilled manpower. Irrespective of our ASDT and all, ASDT can only churn out a limited number of students, right? And also there has to be a willingness in that individual to travel and stay in that place. So that's a challenge that we face. We have ways of mitigating them, which we are doing, but that is a challenge, no doubt, manpower. Because, there is never going to be a nephrologist associated with a dialysis center nowhere in the world. Forget about India. It doesn't even happen in US or Europe, right? So dialysis has to be provided by dialysis technician and nurses under the supervision of a doctor. So skilled manpower, doctors in remote areas, that's a challenge we face. Now, the second part of the question, you said that how are we, sorry, can you just
The
repeat?
second part of the question is in terms of, there are certain concepts like remote dialysis. So
okay.
not in all the places you can establish. a
Okay.
center.
So, when you talk about remote dialysis, there are two things in this. There's a concept of peritoneal dialysis. Now, peritoneal dialysis was introduced globally about 30-35 years back. It's a very good method of dialysis. However, due to some of the critical factors, it has not penetrated the way it would have been, not even in the originating country, that is US. In India today, peritoneal dialysis is only about 5% of the total dialysis. Peritoneal dialysis can be done remotely. There are few challenges related to peritoneal dialysis, but those are smaller problems to solve. The larger problem are awareness, maintenance of hygiene, and all those things. Coming to remotely done hemodialysis, that is a challenge in the rural area as well, because in our country, there's no concept of the patient doing the dialysis on their own, like the Western world. In Europe and US, people do home dialysis on their own. We run a very, very robust home dialysis program across the country, but this is home assisted dialysis, where we set up a dialysis unit in the patient's residence, the entire dialysis unit, and we send our basic life support system trained technician to the patient's residence 3 times a week to provide dialysis. Now, this whole ecosystem, it is not easy to replicate in the rural areas. So that's the challenge. There have been few attempts made to provide dialysis in rural areas by sending buses and vans. But there are challenges in the sense that in dialysis bed, the patient has to remain for 4 hours. Now, patients feel very, very claustrophobic on that. That is one. Plus, there are issues related to environmental governance, because the effluent water which comes out, that's a biomedical waste. So those are the challenges in the country. However, in the rural area, currently the government as well as the entire ecosystem is working on providing or creating dialysis centers, small dialysis centers all across. There's an economy of scale also on that, because 2 small centers are not financially viable. So bare minimum, keeping that balance. So that is what it works. But I feel providing remote dialysis or home dialysis in tier 1 cities till tier 1, tier 2 cities is very, very much possible. That is one of our major growth lever. We are working very aggressively. We are doing also very well on that. However, in rural areas, I still see some more time for this, some more teething challenges to be addressed before it really takes off.
Okay, so last question from my side. Is you've got a couple of investors already in the capital and so on. Someone like Tata Capital, you said they focus, obviously it helps you focus more on quality, and that's one of the major drivers to do. That Tata Capital also helps, right? Other than capital, what is that some of the institutional investors have been able to bring to you on the table? And in the second part of the question is also, you also talked about ESG. Is that somewhere someone like Tata Capital, which has a very strong focus on ESG, helps you sort of address that as an organization?
Indeed, I'll take the first part first. So, the name Tata in our country comes with huge credibility.
Yes.
Transparency, trust, belief. So it's a hugely credible name. So obviously, Tata Capital coming into our board, investing in our organization, has enhanced our credibility significantly. Apex was very, very credible in the nephrology segment because of our founders and the type of work we have done over the last 15 years. Over the last 2 years, since Tata has been a part of our board, now that credibility has also moved beyond the medical fraternity, among the people, among the government, among others. Now, this has translated into many benefits for us. So obviously, when the credibility increases, you have many leverages of business, right? The way you you plan your financial things, the way you structure your capital expenses and all, and the way you get support from the financial or institutions. So that has been a significant advantage. Strategically, Tata Capital team has helped us in many ways. They are extremely involved with us, and they have given us many strategic direction in terms of focusing on the core business, carving out some not so important business which we were also doing, and as well on the operational excellence part. They have even come and helped us in structuring some of the newer business models which were not prevalent in the dialysis industry, which has come from other allied industries, and we are executing them and we are seeing good results. So overall, both for strategic and operational, there has been a significant benefit. I mean, needless to mention, you yourself mentioned Tata's focus on environmental and social governance, on looking after welfare of the employees. So that has always been, they have come with new ideas, they have supported our initiatives towards that, and all those things that have been a significant benefit working with the Tata team.
So, in the interest of time, I know we have almost done the last tea. So, unless GL, you got anything else to ask? We would love to thank you. Thank you so much for being here with us, sharing the insights. It's been a phenomenal sort of journey for you, and hear from you, especially on how the segment is evolving, what are the challenges. So people generally love to stay in touch with you and understand more about the segment. All the best for the journey that you started. And so looking forward to.
No, many thanks once again, Vishal, to you and GL and the Productivity team. We would love to stay connected. Thank you. Have a good day.